Morning,
Good
Julia.
morning. Lots and lots to talk about. What do you make of it, of this rolling out of these doses being donated through COVAX to poorer countries? The reality is, 600 million doses. They're hoping they're going to get up to 1 billion in terms of the total pledge from all the G7 countries and others. But again, that's 500 for most of these, a double vaccine. That's 500 million people. We've got more than 7 billion on the planet who haven't got a vaccine rollout yet. That's not going to be enough, is it?
Well, of course it isn't. It's simple arithmetic, isn't it? 7 billion people on the planet, 2 doses each, 14 billion, and we've heard a pledge of 1 billion. Now, I don't think we should dismiss that. It's clearly a significant step in the right direction. I think the most important point, actually, picking up something Nadeem Zahawi said, is that this is not us being nice to low and middle income countries. There is no safety against COVID in the UK or in the United States or in Europe or anywhere else on the planet until COVID is defeated across the planet. And therefore, what we need to be doing is challenging ourselves to roll the vaccine out to the whole population of the planet in order to make us safe here, in order that we can get back to a normal life.
Well, I mean, safer here. We're not going to. Everyone's got to stop all this wartime language. We're not going to defeat the virus. We're going to make ourselves. We've never defeated flu. We're going to make ourselves much safer, and we're going to get to a position where it is just, unfortunately, another, treated equivalent to another strain of flu, and we're going to have to learn to live with it. The thing is, that was what we
agree with that.
Promised.
I accept that.
Yeah,
I agree.
But it's easy to get into the language, isn't it? It's all very.
Yeah.
We're going to defeat it. We're not. And that's one of the issues.
You're right, Julia. I don't always agree with you, as you know, but I'm happy to be corrected when I should be, as you just corrected me then.
Thank you. That must have been painful. No, Stephen, let's talk.
Not at all.
I'm joking. Let's talk though about this where we are in terms of lockdown and the like, because we are in this situation where the Prime Minister is making his decision this weekend, looking at the latest data about where we're going with this Indian variant and where we are on vaccinations, who's at risk, hospitalisations and all of that. And he's looking at that with a view to making the decision on Monday, telling us the decision on Monday about the 21st of June. I mean, it's fast approaching. My God, it's taken many, many, many months. We've been in lockdown since January the 4th. Some people saying, we shouldn't leave lockdown too soon. I'm thinking, where have you been for the last 6 months? But are we not in danger of trying to get to equivalent to a zero COVID policy, as opposed to what we originally went into lockdowns for, was to flatten the curve so the NHS wasn't overwhelmed? The NHS leading figures have said we're in no danger of being overwhelmed. We were told that the vaccine rollout would mean that the people who are at risk of dying and getting seriously ill were going to be safe. That is already the case. We've seen some more people go to hospital, but lots more people leaving hospital. We've got more hospitals in this country right now than COVID patients. And back end 13th of April, the Prime Minister said, the day after that big move out on the roadmap where we actually saw, retail reopened and outdoor hospitality reopened, he did say, so as we unlock, the result will inevitably be that we will see more infections. Sadly, we will see more hospitalisations and deaths. And people have just got to understand that. But he said, at the moment, I can't see any reason for us to change the roadmap to deviate from the targets that we've set ourselves. We are currently where we are in terms of deaths, cases and hospitalisations below the best case scenarios that were predicted by Imperial College and Warwick. Why on earth would we deviate from the roadmap now?
Well, you know that I've been more cautious than you about the whole throughout this pandemic around releasing and lockdown and getting into lockdown when we need to. I have been more cautious, but I actually think that now you will have seen the front page of the Daily Telegraph today, Theresa May, slightly different point, but reminding us that we have to get back to international travel if we're to be a global trading nation. So I do think that as the government considers the public health risks associated with releasing lockdown, but also the need to re-establish normal life patterns, I do think we're in danger sometimes at the moment of being overcautious. You're absolutely right, and the reason I was happy to be corrected earlier on, we cannot have absolute security against COVID. All we can do is establish sets of principles which allow life to return to move forward to something that is sustainably normal.
Yeah.
And I'm on this. I'm not yet persuaded that it's necessary for us to delay. And the key point there is to remind ourselves why we did lockdown in the first place, which was to prevent the health service collapsing under the strain of COVID patients. And that, if that's the parameter, then I'm not persuaded that there's a reason for us to extend lockdown.
And the hospital bosses like Chris Hobson of NHS Providers has said, we're not under strain of collapse. Even in the northwest and northeast, where there have been big surges in this Indian variant. A lot of that we found obviously through a surge in testing as well. But most people getting it are young people. They're healthy people. Yes, they've not been jabbed, but they're also not at risk. If they are going into hospital, they're going in for not most of them who go to hospital aren't even being admitted. Those who are being admitted, on average, about 2 days later they leave. Very different from what we were seeing in January. Let me ask you also about
the bigger issue in the health service at the moment, as you said in your introduction,
the waiting list.
Is the long.
I was just going to come to that. 5.12 million people, and these aren't people waiting to sort of have a toenail clipped or something. We are talking about people waiting for life-changing, and in some cases life-saving surgery.
Well, indeed. And of course, the waiting list itself contains within it too often people with so far unrecognised life-threatening conditions. Yeah. The health service does its best to ensure that the people with the most urgent conditions get to the front of the queue. But if you've got 5 million people waiting for procedures, some of those, many of them are uncomfortable, but can wait a week or even a few months. But some of them have conditions of real pain and discomfort, making life very unpleasant for them while they wait. Yeah. And a very small number of them will have have conditions that threaten their lives, which are not being dealt with as they should be by a proper modern health service.
Yeah, indeed. Let's also just talk finally about Matt Hancock's evidence to a joint meeting of the Health, Social Care and the Science Technology Committee. He was basically giving his version of events after Dominic Cummings gave that explosive testimony in 7 hours of testimony a few weeks ago. And one of the crucial things he was saying was that Matt Hancock was incompetent and a liar and had lied to the Prime Minister, lied to goodness knows everyone else, and should have been sacked up to 15 times. Matt Hancock yesterday, not so explosive, a rather quiet event, but he was basically denying that there had been PPE shortages nationally and that had been a crisis, also denying that it was the decision to send elderly patients out of hospitals into care homes without testing to make sure they were negative for COVID, which actually seeded that in the care homes, and we saw tens of thousands of deaths which could have perhaps been saved. He basically said, look, it was care home staff that brought it in. What did you make of both of those claims? Because he's got quite a roasting in a lot of the newspapers today for those claims.
Yeah, so taking three elements. First of all, it remains true that Dominic Cummings has not produced any evidence to support his assertions.
Yes, which he was asked to do and agreed he would do and has still not done.
And was asked by a journalist yesterday on his doorstep, as I understand it, where the evidence was, and there was some reference to the TV man being more important, but doing his TV repairs. So I don't have much. Dominic Cummings must either put up or shut up.
Yeah,
is the first point. But having said that, I did think Matt Hancock's evidence was I thought he got the tone wrong, if I can put it that way, because he sounded to me like somebody who'd been told by his lawyers that he couldn't say things that he knew were true. So he was choosing his words so carefully that it was the process of choosing the words that was obvious when we watched him, rather than actually what he could have said, and in my view should have said. Of course we made mistakes. Yeah. We were doing our best in very difficult circumstances. And of course, if we could have had a dress rehearsal, the first performance would have been better. But he was, I thought, more defensive than he needed to be.
Yeah, well, this is all ahead of the public inquiry. And again, I think the British public are remarkably forgiving, actually, of mistakes being made, and accept that this was, a crisis that really people hadn't planned for. And again, I hold the people responsible for a lot of that. The people who we pay six-figure salaries to, pay Public Health England, whose job it literally was to plan for a pandemic, and they spent all the time wagging their fingers at us about eating Mars bars rather than planning and doing the job they were supposed to do. Always so good to talk to you, Stephen Dorrell, former Health Secretary. Thank you so much for joining us.